Hey, you're watching Northern Soul. Today's video we're going to be discussing flat foot fallen arches, and I'm going to show at the end of the video some exercises you can do for that, and as well some stretches and some spa treatment stuff you can do for your feet to help for that particular problem. This is a video I wanted to make in direct response to one of our new subscribers. So shout out to Eva for presenting a question on that flat foot video. And the video itself will be, I'll put it in the description below, so you can link to that and watch that video on kinesiology taping. As well, I'll have it linked at the back end of the video, where you can just click on if that's available on whatever you're watching. Try to make things easy. Okay, so we'll talk about, first she has a question, so I'm going to answer her question. So thanks for the question. Thanks for subscribing. The question is about kinesiology taping versus orthotics. Which one is better? And so she wants me to comment on that. So in my understanding of orthotics, now I don't deal with orthotics, but it's so I'm not like an expert in that sort of thing. I know of it. I don't have flat feet, so I don't use orthotics myself. But in the clinic I work at, there is someone there that does. There's actually two people that create orthotics, and they do all the foot mapping and all that stuff in order to create them. And it seems like the most common thing is for flat feet is to get some sort of orthotics or some sort of insole support for like your shoes and that. So that's like the most common. I think it's one of the most effective ways. But there's also some drawbacks to that, because with orthotics you have to have them in your shoes or whatnot. So when you're, having a shower or just walking around barefoot, you're not getting the support from them. So, and they're very costly. So some people, like, even just to get them to go in for a fitting or to get some custom ones made, that costs money just for an assessment. And then to get them created, we're talking hundreds of dollars. So there's quite a bit of financial cost that is maybe prohibitive for some people to even go in to see a foot specialist or someone that does orthotics. So that's why I'm making kind of this video. And so alternatively, kinesiology taping might be a more cost-effective way to deal with that sort of thing. But once again, they're different. So it's like, so they are different. They're not competing against one another. You can use them together as well. I think you can. And with kinesiology tape, one of the things I like about it is that you can just wear them as second skin. So if you watch the video with the taping, it just kind of supports, it creates that arch artificially, but you own it, because it's you're taped up, and then it creates the arch, that support. And then no matter what you do, once you tape yourself, you're walking around with it, right? So you have all that support the whole time. So then you have that support regardless of what you're doing, whether you're sleeping or working or you have insoles or not. They're always there, which is really cool. So you can be barefoot out in the backyard or at the beach with the taping, and it'll still be effective. That's one of the things I like about it. So it works while you sleep, and it's much more cost effective. Although taping, for some people, they think it's quite expensive to buy the rolls. But if it lasts for a number of days, and it's much cheaper than orthotics. So some people are talking like $300, $400, $500 for orthotics. And if you want the convenience of having more than one set, so you have like a couple in different shoes and stuff, so you don't have to keep pulling them out and switching them into other shoes, then you're looking at multiple versions of those hundreds to get each individual one. Plus with the way the feet work, when you get orthotics, one of the things is that you have to keep up with them, so you have to get new ones, because your foot will I don't know if it's like adapt, but the foot will change, and then the orthotics become uncomfortable. So a lot of people don't realize that you have to, after a couple months or a year or 2 years, you have to get new orthotics. So every year or so, you're talking a couple $100 again on top. So I'm thinking, man, if you got like $300-400 to throw around, how many rolls of tape can you get for that? You know what I mean? And you can be wearing the tape without shoes. Like that's the whole thing. With shoes, without shoes, with orthotics, without. That's the convenience I like about it. But it's I don't want to. This isn't one of those things where it's like don't get orthotics. They're effective for a reason. They're popular for a reason. I say get both if you can swing it. If you can't, then that's a different thing. But you have to make your own choice. So as far as is it a permanent thing? It's like tape's not a permanent anything. You know, it's kind of like a support. It's a tool at the end of the day. So it won't fix your problem of fallen arches. The problem with the flat feet or the fallen arches is the structure of it. So either it's going to be a structural issue where the bones or the ligaments, so if the bones are fused or there's some sort of structural issue where you can't change with exercise or stretching and that, then you're kind of stuck with it. At that point, you're just doing, you're trying to mitigate pain. So you're talking, your primary goals like pain relief and stuff. This is where orthotics may help and kinesiology tape may help. Now, if you have a functional issue with your foot, meaning that the maybe the muscles of the foot that create the arch have atrophied from lack of use or whatnot, then there are exercises, which I'll show you at the end of the video, that you can use to recreate or to build up that muscle, in which case you can then create an arch. So it depends on what your foot is doing. So whether, and you probably need an assessment for that. Otherwise, you'd still need to exercise. You still need to build it up. You still need to train the foot into into having an arch. But sometimes the training won't work depending on the structure, right? So if it's musculature, then yes, you can do something about it. If it's not, I don't want to say there's nothing you can do, because you know there might be somebody smarter than me out there that's got an answer for you. I don't. This is just what I know, so I'm presenting it that way. So it's a help, and what with kinesiology taping, it can help you achieve, like as you're doing the exercises and the stretching, you can still have the tape on, which I think is good because it gives you that support, and so that's helpful, I think. So for me, if you can do both, try them both. If you dislike one, then obviously edit that out, but isn't that true for everything? You know what I mean? If something's not working for you, don't sit there and keep doing it. You know, that's the definition of insanity, isn't it? So I like the taping because that's what I do, that's my knowledge. And if you look at the comments in the video, there's some positive comments about pain reduction. There's one comment where one of the viewers said it reduced their pain 100%, which is incredible. So it does work. You know, I don't know if it'll work for everybody, but I'm putting this out there just because if it helps one person, I mean that's phenomenal, isn't it? So I know if you're watching this, it's because you're looking for some sort of help, and I don't know how you got here or the reason why, but you know, you're here for some free help and some advice and to give it a try, and that's what I'm here for this video. So okay, so another question here is how does the taping affect weakened muscles in the ankles? So with the support of the kinesiology taping, you're not going to get more muscle. You know, it's not going to affect the muscle in a sense that it's going to build it up in any way. It's not. You have to put the work in. So you have to put an exercise regimen into strengthening the muscle and telling the body, yes, you know, I want to develop these muscles. I want an arch, but you have to do, you know, arch building exercises for that. So the tape's not going to affect the muscle. If you rely on it completely, if anything, the muscles might atrophy because you're depending on it, and it'll offload the muscles. So you definitely want to use the tape inclusive of some sort of regimen of developing the muscles for it. So it's pain relief. It's adding structure while you develop. For those of you that have structural issues where you can't fix it with exercise, then the taping is going to be your best friend until something better comes along. I don't know what that is, but yeah, in a way, it kind of is the fix. I think it's practical. as long as you don't have like allergies to the adhesive and stuff, in which like it's very rare, but some people might have an allergy to the adhesive, in which case maybe orthotics would be the way to go, like your better option. So we'll go to the next part where I'll show you the exercises, the stretching, and also the spa stuff you can do for your feet. So using like heat and cold and stuff like that in order to help develop your arch, hopefully, if possible, or at least to relieve some of the pain symptoms of it. So good luck to everybody. Stay tuned for the next part. And if you have any questions, feel free to ask, put it down in the comments. If you have any sort of helpful advice as well, put it down there as well. We're trying to establish like a community to help each other out. And think about subscribing as well. Check out my other videos on the Northern Soul channel, and appreciate everyone's support. So take care. Okay, so for exercise you can use a stair if you have it, or something else that's like a step or a phone book or whatever. What you want to do is be able to just put the ball of your foot on top of the step, and definitely hold on to something. So whether it's like, I'll just show the inside of the foot here. I don't have this issue, but there's the ball of the foot there. I'm just going to hang the other foot off the side here, and I'm just going to push up, take about 1 second on the way up, and then 2 seconds to lower. And I don't need to go down to here because that's like stretching the calf out. I just want to go down to level and then back up again. So push up and then back down, and just kind of have a nice controlled feel about it. So up and then control, down, up, and then control down like that. So you want to do that about 10 times, one set, and then if it feels pretty good and you can do a second set, give that a go, second set of 10. And if that feels pretty good, then do a third set of 10. What you probably want to do the first day is just do one set of 10 and then wait till the next day, see how you feel. If you feel pretty good, then maybe go for that second set of 10 the next day. And if you still feel pretty good, then try to do that a third set of 10. So that you end up doing like 30 of those. Alternatively, you could use like a stepper like this. This is my little wee pad here. So you can just kind of step on that, and you can do both feet. If you wish, you can hang one down like this. And then you want to like hold on to something if you're a bit wobbly. I'm a bit wobbly because I don't practice this balancing stuff. So I'm just going to hold on to something. So whether like push it up on a wall, and then up 1 second, and then down 1, 2, up 1, down 1, 2, and you want to do that for a set of 10. So I'll show the other foot as well. So just wait till you're nice and balanced, and then push up from the ball of the foot. But it's that part there that creates the arch. So if you don't have an arch here and then you push up and it's still flat, that might show that you might have a structural issue, whether the bones are fused or something like that. You might want to get that checked out if you haven't already. But if you have a flat foot and then you lift up into the arch and then you create a bit of an arch there, then it's probably a functional thing where you have some sort of muscle atrophy. And then this sort of stuff, whether it's like jumping and playing, stuff we did when we were younger, will like add to the exercise to that in order to increase the arch, right? So we're going to develop those muscles. Now another exercise you can do is this sort of towel scrunch thing. So this is like an aid in order to help you visualize and then activate the muscles that are creating the arch. So what you want to do is, it's almost like bring the toes and then scrunching it towards you like that, and you can see that I create, with that movement, it almost accentuates the arch. See that pull right there where it starts to create a bend right there? That's what I'm trying to do. It's not so much that the toes are curling and pulling this in. That's its own separate thing. It's the way to start that arch movement like that. So it's almost like doing those Kegel exercises where you pee but you stop it, so you don't pee your pants kind of thing, but you're strengthening that sort of aspect. So you're doing the same thing with the foot. It's a tool in order to initiate the muscles that are associated with it. So there's that pulling. So as I'm trying to pull the towel, and I'm just keeping the toes straight, so I'm not actually trying to curl the toes. I'm not trying to exercise the toes. I'm trying to just get that arch to initiate. So that
pulling, like that initial start of pulling that towel towards you initiates that arch, all the muscles of the arch here. So you want to do that for a number of times. I'd say 10 times. So you start, pull, maybe hold, and then release, pull and then hold. So it's similar to like the stairs, but you're really focusing, using this as a tool to focus and engage the muscles of the arch. So if you do that for probably 6 weeks plus, you'll probably notice that if you don't have any arch, you might start to, an arch will start to appear, hopefully if it's like a functional issue with the foot. So hope that helps, and happy curling here. There we go. Just try to engage that sort of thing. Hope that helps. Okay, here's an example of stretching the underside so that you can stretch out the muscles associated with the flat foot, as well as the fascia underneath the foot. So right here I've got some shungite balls. Don't laugh. This is what I have around. So in practical terms, I've got a soup can here. These are all tools you can use and find practical. You can also use like tennis balls. They're nice because they have a bit of give to them. Bottles, so beer bottles, whatever you have that rolls and is round, and then you just put your foot right on top of it. Just make sure your feet are clean before you do this, otherwise then you could use something that's just for feet. So if you have a tennis ball, just use that tennis ball for your foot stuff if you end up in like public areas of where you're barefoot and stuff like that, just so you don't contaminate, like cross contaminate like your food and anything else, right? So I'm just going to roll underneath the foot like this, and just kind of just keep rolling it. Watch it if you have any sort of pain associated under the pad here. That might be like plantar fasciitis or other issues as well. So I want to get that checked out if you haven't had it diagnosed as well. But if your foot's painful with flat foot and stuff like that, the stretching technique like this can really alleviate maybe some of the problems with it. So just do that. You can do that for a few minutes. Here's a can of soup. So you just roll back and forth like that, up to the heel and then to the ball of the foot, and just roll. You could be watching TV or whatever and just kind of do that sort of thing. And like I said, you can use a bottle or anything like that. So that's practical stretching. Do that for a number of minutes. Best thing to do it is to, prior to doing any of this sort of stretching, is to apply heat first. Now, prior to exercise or for stretching, you might wish to also use heat to make the area more malleable. Now, if you're just finishing an activity and it's kind of acutely painful, you may wish to use ice instead. So you can use like a wash basin or a tub or something like that. Fill it up with cold water. It doesn't have to be freezing, but cold. Or you can get like a bag of ice and put it on top for 5 to 10 minutes, 10 minutes tops, and then remove it to kind of calm down the area. Anti-inflammatories and muscle relaxants might also be indicated or useful. Talk to your doctor about that sort of thing if that's helpful. I've got a microwavable heat sack here, so you can just put it in the microwave for a minute, minute and a half, depending on your microwave, like how strong it is. It might be 2 minutes if it's like an older one or a weaker one. And you just have that nice and hot and just wrap your foot in that sort of thing and just let it sit for a number of minutes. These things last, you usually got to hang around the microwave for a bit because they cool off pretty quick. The other thing to do is if you have like an actual plug-in, like electric heat pad, and then you can wrap your foot in that. But this is pretty practical just to have that around and just kind of get some in preparation for the stretching or the exercises, or just when you're chilling at home. This might be a way to just get things like a little bit more malleable, get things to relax as well and calm down. You can use the kinesiology tape during the stretching, exercise, and the heat as well, and that's what I recommend. So if I had flat foot, that's what I would be doing. It would be taped up already, and then I'd be doing all that. Now, if we're talking heat therapy, thanks Dexter.
The one thing you can do is use like hot water on the feet as well. So you had a long day or your feet are killing you and that sort of thing. So I got like one of these things. It's just you plug it in. It just has the bubbles and all that stuff and some vibration, and tries to keep the water warm. But it's not powerful enough. So what I do is you can just get a regular basin, like a Tupperware container or something like that, or one of those big ones. That fit your feet well enough, and or you can use like your own bathtub, that sort of thing. You got a tap right there with hot water, but this one I usually just grab hot water from the sink, like in my laundry room, fill it up with hot water. Just make sure it's not so hot that you're going to burn yourself with that, so precaution there. If you need to, use a thermometer, so 45 degrees Celsius or less. For me, 45 is too hot, but that's because that's just me. But you should be safe if it's like under 45 degrees Celsius. The other thing is, you can also add like Epsom salts and stuff like that. So this is actually, Epsom salt's good because it'll mimic like a mineral spring, a hot spring. That's a good thing for even in the bathtub, generally speaking. So even if you want to do like systemic where you just have a bath, same idea. So hot tub, whirlpool, saunas, they all count, but something practical like this where you can just kind of stick your feet in, like I still got jeans on, just roll them up, put it in there. It's practical, 10 minutes and then your feet are refreshed. So Epsom salt's good because it has that magnesium in there as well, which can sometimes help with muscles as well. There's magnesium sprays you can try. There's also, I like to use Dead Sea salts as well. There's just more minerals and stuff in it. I find it's very concentrated, so it's more expensive than Epsom salts, for example, but you get more out of it because you're going to be using less. So this is Himalayan salt right here. Sometimes I'll use that. It will kind of leave residue on the tub if you're in the tub, so it might leave like an orangey pink film. So for some people that's too much work to clean that sort of stuff, so that's a no. Epsom salts is easier to clean afterwards. As well as you can also use like a Dead Sea salt or something that has essential oils already integrated into it. So this is one here. So this one, I don't think it says what it has in it, but it's like a medium coarse or pretty coarse. So you get a little scooper and you can see there's essential, you can't smell it, but this one smells like it's almost like you're in the forest. So it's got essential oils already in there, not fragrance. So if you go to get like Epsom salts and stuff, just be wary that sometimes it'll say lavender scented or something like that. That means it's not actual essential oil, so you won't get the benefit from it. So you want to get one with actual essential oil, or get a basic one that doesn't have anything in it and then add your own essential oils. So you can get those in health food shops, and some of the bigger grocery stores and Walmart and stuff might have an aisle, like a health aisle, that you can find essential oils. So recommended essential oils for like feet would be peppermint's a good one. Just be careful when you're talking like heat and stuff, because sometimes the peppermint can really accentuate the sensation of it. So you don't want to get too carried away. Just watch like 1 or 2 drops, maybe 3. Something like this would be like, depending on your tolerance, start off with 2 and then add a drop or 2 as needed. So if you have a full bathtub, that might be 5 drops, but something like this might be 2-3 drops. I'd probably go 3, something like that. Otherwise, lavender is a good pick. It also has a calming effect, but also is disinfecting as well, which might be good on the feet as well. Good option, cost effective, is like tea tree. Tea tree is a popular one as well. A longleaf pine is a good one. Eucalyptus is a great one as well. So just keep that in mind. You can also mix and match. I was going to say the flavors of it, but that noise in the background is Dexter making a nest on the bed so he can lie down. He's tired. Okay, so that's heat. Cold, if it's you want to use 5 to 10 minutes of cold, obviously you get a pack of ice, or you can have like cold water in the tub or whatnot and just stick your foot in. Or if you're out hiking and that and there's a river that's got cool water, and you can always dunk in there, in a pinch kind of thing. But heat generally, if it's not an acute pain and you just need to kind of unwind the feet, or they're really crampy and stuff like that,
then you might find that heat's more effective. Trust your body, it'll tell you. So if you use cold and it feels worse, or if you use heat and it feels worse, then you want to use the opposite then switch it. So that's a good general rule of thumb, is if you use a heat or a cold and it starts to feel worse, then you know you got to do the opposite. Okay, hopefully that helps.